pharmaceutical companies are already working literally around the clock on the development of therapeutics that will be medicines that can bring relief to people that contract the coronavirus. And I know how pleased the President was to learn that the commercial labs in this country, led by companies like LabCorp and Quest, have already brought a test forward and are taking that to market effective today. We also met today in a conference call with 47 of America's governors. We were able to brief them on the latest, the progress that we've made. We were able to confirm with them that testing is now available in all state labs in every state in the country. Over 1 million tests have been distributed before the end of this week. Another 4 million tests will be distributed. But as I said before, with the deployment of the commercial labs, we literally are going to see a dramatic increase in the availability of testing, and that's all a direct result of the President's leadership. Today, a brief word about the Grand Princess. The Grand Princess has docked this afternoon in Oakland, California, at a commercial dock. 25 children. We were happy to learn through the screening over the last 2 days. The 25 children on the ship are all healthy. Of the people that have contracted the coronavirus, 21 in all, they are being dealt with in proper isolation, working with health authorities in California. We hope before the end of today to begin to disembark California residents to Travis Air Force Base and Miramar. We've made arrangements with Canada and the UK to take their passengers back. They'll be transported directly to the tarmac, charter flights home, and tomorrow the remaining passengers will be transported again through very, very carefully controlled environments, buses, out to the tarmac and flown to military bases in Georgia and Texas.
Are people over the age of 60, they're much more likely to develop complications from the coronavirus and to be hospitalized from the coronavirus. The average age of death is age 80. Now, what we also want communities to know is that if you are a child or young adult, you're more likely to die from the flu, if you get it, than you are to die from coronavirus. So there is something about being young that is protective. We want people to be reassured by that. We want people to know that we are really focusing in on those groups that are at highest risk for complications and helping them understand how to be safe. And this new advice that's going to be coming out tomorrow is designed to keep our community safe, to help keep the most vulnerable safe. And it's important to understand that even though young people aren't at risk for dying from coronavirus, they can potentially spread that to older people in the communities and people with chronic diseases. So it's important we all take precautions, washing our hands, covering our cough, keeping our distance from people who are sick, and taking the steps that will be coming out in this new guidance to help make sure we're doing everything we know possible to keep our most vulnerable protected.
I think if you're a healthy young person, that there is no reason, if you want to go on a cruise ship, to go on a cruise ship. Personally, I would never go on a cruise ship because I don't like cruises. But that's another story. But the fact is that if you have the conditions that I've been speaking about over and over again to this group, namely an individual who has an underlying condition, particularly an elderly person that has underlying condition, I would recommend strongly that they do not go on a cruise ship.
So we've told you, we'll tell you what we know and what we don't know, okay? So there are different types of tests that get sent out. The CDC's test that CDC is sending out, that's that enough to test 75,000 people that was sent out last week. Those go to public health labs, about 80 labs in the United States, one in each state at least. Those report results back in to the CDC because they're part of the public health network. The larger quantity of tests that shipped, about 900,000 of the tests that shipped by this weekend, and then so many of the remainder of that total 2.1 million tests, those go to hospitals, private labs, others for testing. They don't currently have to report to us that they've conducted a test or what the result of that test is. The CDC is actively working right now to build that IT connectivity with them so we can gather that information. So right now, I could not give you a number of how many Americans have received a test, because many will have received a test through hospitals or non-public health labs. And so let's work. We're getting the system, the IT system, up through CDC. We want to give you accurate information as we go.